Dear President, dear Member of Congress, dear guests, first of all, Mr. President, congratulations on your elections. It is a great honor to be here today and take part in a discussion that touches upon the very core of social cohesion in Europe. The topic we are discussing is not merely relevant, it is deeply human, political, and ethical. In Greece, as well as in many European countries, healthcare systems are under increasing pressure. The pandemic acted as an accelerator, highlighting both their resilience and their weaknesses. Today, we are faced with a new, more complex reality: economic pressures, demographic aging, and growing mental health needs. These challenges also include new migration pressures. It is precisely at this point that the crucial role of local government becomes evident. Municipalities and regions are on the front line and understand better than anyone the needs of their citizens. As mayor of Papagou Holargos, a municipality in the Attica region of Greece, I represent an urban municipality of 45,000 residents with a high education level, a significant aging population, and growing social needs. I can assure you that access to health care is not given. It is a daily and ongoing challenge, and municipalities play a key role in supporting primary care and vulnerable groups. In many cities, including in our municipality, municipal clinics operate with the support of volunteer doctors, offering free services to citizens in need. However, and here I refer to my country, these services are not sufficient everywhere, while in some municipalities they are completely absent. As a result, citizens are inevitably forced to turn to public hospitals. Although public hospitals have improved in recent years, both in infrastructure and equipment, challenges still remain. The pressure on emergency departments, long waiting times, and the need for more medical and nursing staff clearly show that the healthcare system continues to be under strain. The situation is even more concerning in regional areas. In island and mountain regions, the lack of adequate staffed healthcare units is a daily reality. There are fellow citizens for whom access to basic healthcare services is not self-evident. People who are forced to major urban centers to receive the necessary care. This constitutes a substantial inequality, which is not in line with the fundamental values of Europe. For this reason, the response cannot be exclusively national. It must also be European. The European Union has played a decisive role in strengthening healthcare through targeted policies and funding, including programs such as EU for Health and, of course, the Recovery Fund. A notable example is the Greek Ministry of Health's application called My Health, which allows citizens to access prescriptions, to show on your mobile phone all the historical data, to test referrals and results, and schedule appointments. Europe, as we all know, is not merely a framework of rules. It is a mechanism of solidarity. And this solidarity must be reflected in the everyday lives of citizens, in every city, in every neighborhood. Within this framework, the role of municipalities can and must be further strengthened. Municipalities can become key pillars of a more resilient equitable healthcare system. By developing more local primary healthcare structures with the necessary staff. By operating mobile health units in remote areas. By implementing prevention and health education actions in schools and communities. By strengthening mental health services at local level. And by utilizing telemedicine so that every citizen, regardless of place of residence, has access to healthcare. To make this possible, 3 key conditions are required: adequate and targeting funding, institutional empowerment of local government, and meaningful cooperation with national healthcare systems. Municipalities cannot and should not replace the state. However, they can strengthen and complement national systems, bringing them closer to citizens with flexibility and responsiveness. Ladies and gentlemen, the challenge is common across Europe. How do we ensure that no citizen is left behind? How do we reduce inequalities? How do we maintain social cohesion in an era of constant pressure? Healthcare is not only a national responsibility, it is also a responsibility at the local level. And if we aspire to a resilient, fair, and people-centered healthcare system, we must invest in where policy meets people, in our municipalities. Thank you very much.
Thank you very much.